You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello and thank you for joining me. I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. To learn more, check out holisticdentistry.au. Thank you for joining the Dental Zone. I hope you're enjoying these series of podcasts on holistic dentistry, health and well-being, and how your dental health impacts on your overall health. So let's get to it and let's get in the zone. So tonight I'm going to talk about safe amalgam filling removal. It's been very requested and I know you've all been waiting for it, so I hope I do it justice for you. So we're going to start with exactly what is the problem. Well, an amalgam filling, or a silver filling as a lot of dentists will call it, is not exactly that. It's a mixture of different metals, so silver, tin, zinc, copper. And you go, okay, well, that doesn't sound so bad. But when you realise what's happening is it's mixed in with mercury. Now, those fillings can be 50%, 52% mercury. And what I was trained as a dentist is that once you've mixed all those materials together, the mercury is now bound and locked into the filling material, and there it stays. And they showed us a lot of science papers to back that up. But that science was done on pieces of filling, pieces of amalgam filling, not in human beings' mouths. Now, in a human being's mouth, it is warm. There is saliva, which is a salt solution. And there's also chewing. There's clenching, there's grinding, there's swallowing, there's hot fluids, hot foods. We brush our teeth. All those things stimulate the surface of the mercury filling, and that creates a release of vapour. Now, the dental profession will admit that that happens, but they will tell you very quickly that it's in such small quantities that it's not significant. However, there's a level at which materials or metals, toxins, etc. are considered to do harm, and you have a level for that. So it can be certain parts per milligram or something like that, for example, or part of your body weight. Well, for mercury, there is no safe exposure limit. So I just want you to bear that in mind as I'm talking on this video and while you're here live, is that there is no safe exposure limit to mercury. Yet as dentists, we are legally allowed to mix it into a filling material and implant it into your tooth, which is inside of your body and only inches away from your brain. So mercury is a heavy metal. It's as dangerous as lead and arsenic. Yet, dentists like me were trained that it's perfectly safe, that once you mix it up and you make the dental amalgam, that mercury somehow magically stops being toxic. However, there's been a lot of studies that show that the mercury evaporates as a vapour, and this happens every time there's any heat or friction that gets applied to the teeth and fillings. So you can imagine that every time you have something to eat, you have a hot meal or a hot drink, you're brushing your teeth, you clench your teeth together, you grind your teeth. When you swallow, your teeth actually come together as part of that process. And we swallow about 3,000 times a day. So every time you swallow, you get a little puff of mercury vapour gas coming off the surface. So that's coming out of your filling as a gas, and you're breathing that in. So when you breathe it into your lungs, it gets transferred into the blood. And from there, it wants to go into our cells. It wants to go to areas where it can bind. So mercury will go into the cells in our body and also into our brain, and it will attach to the nervous tissue or the nervous cells, and it will also go to the pituitary gland. And studies show that mercury is released from those amalgam fillings, and it appears in the kidneys, the brain, the thyroid, and the wall of the intestine, so inside your gut, just to name a few areas. Studies show that that mercury gets released and it goes from the amalgam fillings and it travels around the body. And studies were done on sheep, using radioactive mercury, which doesn't occur in nature. And then they were able to use a Geiger counter, which traces radioactivity, to see where that had gone. And I'll probably talk about that a little bit more as we go on. So an amalgam filling as small as 2 millimetres by 2 millimetres releases around 15 micrograms of mercury per day through wear and evaporation. And the average person is going to have around 8 amalgam fillings. So they could be absorbing 120 micrograms of mercury per day. Well, so what? What does that mean? Well, when you compare that to the daily uptake of mercury, say, from fish and seafood and environmental exposure, that adds up to about 2.6 micrograms. So 120 from 8 small mercury fillings compared to 2.6 micrograms per day. Now, I'd consider that a very, very significant quantity. Soon as we're told as women when they're pregnant, don't eat tuna because it's got mercury in, because there's a risk to the baby, yet nobody says to that lady who's conceived or about to conceive, hey, you've got mercury fillings, perhaps you never want to chew or touch your teeth together again while you're pregnant. And I know that might seem as though I'm being a bit over dramatic, but this is the point I'm trying to make, is that we're overlooking something that is a huge problem and nobody's talking about it because dentistry wants to pretend that this is okay. So contemplate this. When we drill out an amalgam filling at the dentist, that drill is going around so fast it creates immense friction against the filling. Yes, we use cool air and cool water, and we try and minimise that friction for you. What does mercury do to the body? Well, it's very toxic. It kills the neurons, which are the nerve cells. It damages DNA. It interferes with metabolism. It interferes with the way your body communicates. Your immune system starts to see your cells and your proteins that the mercury binds to as alien, and so your immune system starts attacking that, which is great, but the problem is it then thinks all your other proteins and cells are also a problem, and it can start attacking those to go on to give a autoimmune disease. Mercury damages us. I was talking to a patient a few years back who's a genetic scientist, and he was saying if they want to damage or mutate DNA, in the lab, they'll just drop mercury on it, and straight away they've got that damage that they want. And the other problem is that, Natasha, is that mercury is accumulative. So each day you're getting exposure, getting more and more and more build up in the body to a point then where your body can't deal with that toxin and you start to develop signs of ill health. Then the problem with mercury is it causes so many symptoms that it's very hard to backtrack it, and it's very hard for our medical professionals who aren't trained to look for mercury toxicity to put the pieces of the puzzle together. So you can have symptoms from headaches, ringing in the ears, brain fog, fatigue, irritable bowel, digestive issues, problem with adrenal and thyroid, heart arrhythmias, which is where your heart goes really fast, pins and needles, aches and pains in your muscles and joints, and just so many different things depending on what the weaknesses are in your body. Now, I'll share with you, because you've got me on a go now, is that I was exceedingly mercury toxic from exposure, from occupational exposure. I've never had an amalgam filling in my tooth. Been very blessed to have my mum being so obsessed with me not having sugar. I think she might have gone overboard and I've ended up doing dentistry because of it, but there you go. But I was fatigued, really, really tired all the time. I couldn't eat enough to satisfy myself. It was just like I was always hungry, just craving food. I felt like I had constant PMS, be very moody. 1 minute I'd be happy, laughing and joking, and the next I'd want to smash the room up or get teary. I got coughs and colds and flus all the time. My joints ached, and I got to the point where if you gave me my change in the supermarket, I couldn't add it up to tell you whether you'd given me the right change. And like, I'm a woman with 2 degrees. I consider myself to be pretty smart, and I couldn't make my brain work properly. and I'd fly into rages. And these are a lot of symptoms of mercury toxicity. So that might just give you a little bit of background. So back to what happens in the dental office. So you're going to the dentist, you've got an old amalgam filling, there's some decay or it's cracked and it needs replacing. So we're drilling on that, and that drill creates a lot of friction. As I said, we've got the water spray, we've got cold air going on it, yet you're still getting friction. And that friction is going to cause a massive increase in mercury vapour. It's going to get released really acutely in a big, big plume from that filling while it's being worked on. And add to that, that just like if you're chop sawing through concrete or tiles, you're getting all that dust coming off. You're getting the same thing when you have an amalgam filling drilled out. So you're going to get all those bits of filling splattering around inside your mouth. And you've got to wonder how good that is for your health when that process is going on. Now, also to mention the health of the dentist, their team, and anyone else who's present in the treatment room at the time. So dentists are continually getting exposed to mercury vapour, A, when they're mixing up the filling and popping it into the teeth, B, in particular, when we're drilling it back out. Even when you're having a scale and polish, that's creating friction and it's going to be releasing mercury vapour. Good question. Whose idea was it to use this stuff? Well, about 200 years ago, we didn't have many options and this material was invented. And there was two branches of dentistry one who went, okay, well, this seems like a good idea, we'll use it. And another branch who went, no, this can't be good. And to cut a long story short, the branch that went on to say, we like this, we're going to use it, formed the American Dental Association. Anyone who's in the room is getting exposed to that. They're breathing it in. Those particles are splattering all inside your mouth, and your mouth is highly absorbent. There are loads of little blood vessels up close to the surface, and that's why we can pop medications under your tongue and they'll act really quickly. So those particles splattering all inside the mouth, sucked into the bloodstream, and also you're going to swallow them and possibly inhale them. So you go, well, we've got to take these amalgam fillings out at some point in their life. I mean, if there's decay or there's a problem, or we can elect to do it, as a lot of people who come and see me do, because they're either already unwell and they're trying to get themselves healthier again or to stop themselves deteriorating so quickly. You know, they've been maybe to an integrative GP or a naturopath and they've picked up heavy metal or signs of heavy metals and mercury. So they come and ask us to remove it and remove it safely for them. And I also get a lot of patients who are concerned about the mercury in the fillings, don't want to wait until they've got health issues. They want it gone and they want the peace of mind. So if you're wanting to replace your mercury fillings, you need to find a holistic dentist. And I mean a proper one, not one who's just labelling themselves as that, because this is happening more and more. And what I do is I ring around a lot of these offices and I pose as a patient and I ask questions to find out how much they know, what equipment they're using, what they're going to do to look after me. And I can tell you that sometimes the answers are quite worrying. So you want to find a dentist who really understands the issues with mercury, and look for one who is what's called SMART certified, because that means they really know what they're doing. Now, SMART stands for Safe Mercury Amalgam Removal Technique. And this technique protects you from unnecessary exposure to mercury. And it means that the dentist understands and does what is needed to keep you safe and support you through the process. Well, there's not many SMART certified dental practices in Australia. Ours is definitely one of them, and it's quite a rigorous process where you have to read a lot of materials, you have to answer questions, you have to show that you've got the right equipment and that you know what the stages are that need to be done to protect the dentist and the team, and most importantly, the patient. Got to find yourself a dentist who's going to remove those mercury fillings safely. Now, two things can happen when you go to a mainstream dentist. You'll say, I've heard about these mercury fillings, I'm worried about them, I'd like to have them removed. So answer number one is going to go, oh no, don't be stupid, they're fine, they're really safe, leave them alone, blah, blah, blah. Okay, and that's cool, because at least they're leaving them alone. And you've got the option then to go somewhere else and get it done safely. My concern is the dentist who goes, oh, okay, I'll do that for you, because they want to be helpful and they want to care for you and they want to give you what you're asking for. That's the dangerous scenario, because they're drilling away at those fillings, exposing you to mercury vapour, no idea what they're doing to you, and you're getting no support to detox your body, and you're getting no protection against what's going on. So it's important that when we do amalgam removal or we remove mercury fillings, that we don't overly challenge your immune system. So we don't want to remove too many fillings all in one go, and we don't want those sessions too close together. We also want to help you get your body prepared before we start. So we'll always have a consultation with you. We'll get to know you. We'll get to know your health history. We'll talk about what we do so you understand that we are what we say we are. We have a really thorough inspection and examination of your mouth, all your teeth, your bite. We check out those mercury fillings, talk about all the pros and cons, and then we formulate a plan going forward based on your individual health needs. So if you're fit and well, we can go ahead a little bit faster. If you've got a lot of health issues, then we need to back off and slow down. We need to support you if you're not already under the care of a naturopath or an integrative GP. And we'll recommend some dietary changes and some supplements that are going to help support your body through a heavy metal detox. So we don't want to schedule too much too close together, because your body's going to go into overload and you can end up feeling really well. I'm going to talk a little bit about how we do this now. So as a SMART certified holistic dentist, here's what I do. So after spending time with you in the consult, as I've just said, and we've talked about your health and your well-being, I perform that thorough inspection. I'm going to check your mouth, check your teeth, your gums, check your bite and your jaw joint function. I'm going to see how many mercury fillings you have. I'm going to have a look at their size, how many surfaces of your teeth they cover, the volume of filling material, and we'll do that by taking x-rays so we can see how deep and how wide they are. And I'm also going to see where they are in your mouth, because that helps me plan a way around. We don't want to be numbing you here and there and here and there and then coming back and working in the same spot over and over and over again. I'm also going to be checking for any cracks in your teeth, any decay, any infections, or any active gum disease. I'm going to take x-rays and photographs, because that's going to help me diagnose exactly what's going on and help me to formulate a proper treatment plan. So we're going to improve your dental health and also ensure we carefully plan out the amalgam removal schedule. I'm going to recommend what you require to help your body cope during the process, and that'll be via some medical support and nutritional support where required. So like a conventional dentist, we still numb your teeth. I mean, we don't have magic wands and we're not all chanting and doing, healing bowls, and I don't mean any offence there, but I think sometimes when people see that we're holistic, that we've got some sort of magic formula whereby we don't have to work like dentists do. Now, we work conventionally, we still have to drill, we still remove and treat infection and decay, but we are more of a philosophy of we need to be using materials that are in line with the body and removing toxins to keep you well or allow your body to function more normally. So I'm going to numb the teeth. I'm going to apply what's called a rubber dam, and so that's a sheet that we isolate the teeth I'm going to work on. So it acts like a little physical barrier that's going to prevent particles and lumps of amalgam from splattering into your mouth. So we've got this sheet and I make some holes in it and the teeth are poking up like that. And so as I'm drilling, the bits are washing onto the sheet, not inside your mouth, and then they go up the suction. Now we have a special device on our suction called an amalgam separator. And what that does is it collects all the bits, because otherwise the fine bits are just going to wash out into the water supply and we end up polluting the environment with mercury that way. So that rubber sheet's going to be sitting over the teeth, just resting outside your mouth like a little funnel, and that's going to be that barrier that's going to stop the bits of amalgam splattering into your mouth. Now, it makes a good barrier, but unfortunately it's not perfect. We can't get it really, really watertight to contain all the debris that are generated. So we're going to get it fitting around your teeth best we can. We put some little barrier creams around, we tuck it in nice and tight, so that we can hold as much of that material in there as we possibly can. And I'm going to then fit you with a nasal hood or a little nose piece, and that's connected to a tank of clean, sterile air. And we turn that on, and that's flowing under positive pressure into your nose to ensure that you're breathing clean, non-contaminated air while we're working, because I don't want you to sit there and try and hold your breath for the whole appointment. And then what we do is we also have a very large suction machine that's got huge banks of filters in there. These were originally designed for hospitals, for picking up aerosols, bacteria, particles, chemicals, etc. And they realised that it actually holds on to mercury really, really well. So we've got this machine, we wheel that in, and it's a specialised filtration machine, and it's called an IQ Air HG Pro. We call him Jumbo, which I think is far friendlier because he's got this big elephant trunk, and it's going to vacuum up all the particles of mercury vapour, so we're not breathing them in, and they're not contaminating the treatment room or those of us in there, so the bits of mercury vapour aren't landing back on clothes and skin and being transported everywhere. And then my dental assistant and I will wear respirator masks for our own safety, and we kind of have these two little things sticking out. Looks a bit like a jet fighter pilot mask. We have a bit of a laugh with our patients that we're having a Star Wars Darth Vader moment, and that just helps people relax, shows that we're human. So we're also going to have negative ion generators and filters running in the treatment room also. So if there is any chance of any little particle escaping, then that's going to bind them and collect them up for us. So once we've got you all set up and we've got you dressed and ready to go, I begin by removing the fillings. Now I want to get them out in as large pieces as possible. So I'm going to chunk them up into segments and limit the amount of small particles or breakdown debris that are coming out from the filling material. We've got you set up. We've got the rubber dam sheet on. You've got your nose hood on. The trunk for the vacuum filters sitting under your chin. We've got our respirator masks on, and we're all ready to go. So I'm using my special drill bits, and I'm going to break those fillings out in nice large chunks. And if there's any decay formed around or underneath the filling, we're going to remove that at the same time. So while I'm drilling, we're going to have the large dental suction right in as close to your tooth as we possibly can. And I'm going to insert the smaller one right up underneath the dam, just in case there's any mercury vapour escaping through that join of the dam and your tooth. As I said, we can't get a perfect seal. I can't take your tooth out, take your amalgam out and pop it back to you, because that's not the way we do things unless you want all your teeth dead. So once the amalgam's out of the tooth, I'm going to clean any residue of oxide of mercury that's left around the new edges. And you can often see that it's like a grey or a brownish coloured rim around. And we're going to do that very gently and very carefully, because we want to make sure that we're not taking any tooth structure away that we can prevent. So we're just going to go really, really careful there. So I'm going to get all that removed. And if it's not completely removed, what I find is that it stops the new filling bonding to the tooth really well. So we want that nice, clean surface to be able to get the new filling, the tooth-coloured filling, to bond really nicely to your tooth. So when I'm satisfied that I've got all the amalgam out from the tooth or the teeth that I'm working on, I'm going to take off the rubber dam. I'm going to thoroughly wash and rinse around inside your mouth with high-pressure water and suction. Just, if there's any little bits there, we don't want them lingering on the insides of your mouth, and I certainly don't want you swallowing them. We then sit you up and we get you to have the best rinse out you possibly can, even while you're numb. I know it's difficult, but we just want to make sure we're getting all the bits away. While you're doing that, myself and my dental assistant, we're going to change our gloves, we're going to change the suction hose ends, and we're going to put all clean things back on before we put the new fillings back in your teeth. I don't want to have dust from your mercury fillings on my gloves, which I'm then putting back inside your mouth, because that defeats the purpose. Then we're going to restore the tooth with non-toxic materials that are gentle on your body as we possibly can. And I'm also going to look for a material that gives a good longevity. I want it to have a long life. So we want to choose materials that are non-metallic and friendly to your immune system. So we're really lucky now in dentistry that we've got such a range of products to choose from. We've got some amazing ceramics and porcelains for teeth that need more strength, and we've got some great white fillings now that have high ceramic content and are low in plastics. They're BPA free, and as far as we know, with the level of testing and research that's available to us, that they're as safe as possible for your immune system as well. So as part of getting these fillings out of your teeth, we also need to support you in a detoxification process. We want to help your body detox from mercury, because you've been exposed to that from the moment since those amalgam fillings were placed in your teeth. And I always encourage all of my patients to take something with the support of other healthcare providers who can assess and monitor the heavy metal detoxification. So that can be through supplements, diet. It can be done with chelation, which is where they'll inject things into your bloodstream to help take it out quicker. And you can do chelation with tablets and drops as well. And it all depends on your health and well-being and how much is in there. So taking those amalgam fillings out needs to be done in a considered and safe manner. We've got to ensure that you, the dental team, and the environment are not being exposed to mercury. We want to use the correct safety equipment. So we've got to take those mercury fillings out in a safe manner. We've got to ensure that no one's getting exposed to mercury. We want to use the correct safety equipment and make sure that we're going to replace those fillings with the best possible material. We're going to support you the best way we can to detox effectively from the process. Now, it's important to support your body to detox. We need the supplements, we need correct nutrition, because we've got to maximise the benefits of no longer having amalgam mercury fillings, drip feeding mercury like a little tap going into your body. So by doing it safely, you're going to have peace of mind knowing that your metal fillings have been safely removed, but you're going to have a healthy and natural looking smile again. You don't have to have silver mercury fillings in your teeth, and that there is a way that they can be replaced, and you have every right to have them done with as much safety protection as possible so that you can arm yourself when you go to the dentist to ask the right questions. Ask them, do you use a rubber dam? Is it non-latex? Do you use a separate air supply for me? Do you or your team wear respirator masks to protect yourself? Do you have an air filtration machine that you use to suction up the mercury? Are you using negative ions and filters? What materials are you going to put in my teeth? Are they strong? Are they long-lasting? Are they BPA free? Are they gentle on my immune system? Ask them, how are you going to support me to detox? What do I need to do to prepare myself prior to undergoing the process? What do I need to do when I'm going through the process? And what do I need to do afterwards? Now, if that dentist is holistic or SMART certified, they're going to be able to answer that and give you all the information and support that you need. If they're not and you're unsure, then my advice would be do not go ahead. Do your research, take your time, find the right person for you.
Because it's essential that if you're considering amalgam removal, particularly for your health reasons, that you don't expose yourself to more mercury. Thank you so much for joining me. I'm Dr. Rachel Hall, holistic dentist in Brisbane, Australia. Check out holisticdentistry.au for more information, or you can give our clinic a call to book an appointment for your amalgam removal, 0737 20 1811. This is the Dental Zone podcast. Thank you very much for being in the zone.
You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.